We have a great program for you, so I don't want you to miss a minute of it. I hope you enjoyed having refreshments on the terrace downstairs. And we could have probably stayed there a while longer and talked some more, but we've got a lot of good things in store for us here. Welcome, I'm Pat Williams, Chair of TAG Health, and we have a great program, so let me just begin with a few announcements here. First of all, I would like to welcome, it's a special welcome to some of our Brookhaven council members. Villa Cristina is actually in the city of Brookhaven, and Brookhaven is DeKalb County's newest and largest city. So with that, would you guys please stand? And we have Bates Matheson and Rebecca Williams. And I'll just give you a brief, we are really lobbying with Bates and Rebecca to push health IT in the city of Brookhaven, and we want to have an educated pool of students to be able to fill your businesses across the metro area and the state. They would stay with us to hear the rest of the program, and I wish they could, but it's going to be videotaped, so you'll have the opportunity to see it later if you can. But they have a council meeting that they have to get to. So we just welcome you. Thank you so much for coming. We appreciate it, and welcome the city of Brookhaven to TAG Health. We have another large event coming up in case any of you haven't heard yet. It's the Health IT Leadership Summit at the Fox in Wayne. Could you come tell us a little bit about that?
Thanks, Pat. I have the honor again this year to be the chair for the 2013 Health IT Summit. It's going to be on November 12th. By a show of hands, so I would like to ask this question. Who in the room, how many of you in the room, know exactly what's going to happen in the nation under the ACA, the Affordable Care Act, and know where health care is going over the next 5 years in the nation? Okay, we got a couple of guys, which is good. So I do invite you to come talk to me because we may want you to speak. For the rest of us that don't know exactly what's going to happen, please come. There on the table, there's you'll hear Jody talk about the Innovation Awards, but there's a link at the top to the healthitsummit.org. And so please visit there if you haven't already signed up. It'll be a great event. Thank you.
Well, we have a full house tonight, so we expect to see all of you again at the summit. And to create some enthusiasm, I want you to take note of some forms that were on your table regarding the Intel Health IT Award. This will be our third award that we're going to be presenting at the summit. So we're looking for those top candidates to highlight and then ultimately award. So if you are an innovative health IT company, product, or service, please submit your nomination. Don't be shy. Thank you.
I would like to also take this opportunity to thank Verizon Wireless for being our summit sponsor. They have been our summit sponsor since we have the premier sponsor since the inception of the summit in 2010. So we're very, very thankful for that. And we have other great sponsors, but they are our lead one. With that, I'd like to also introduce you to some new companies that have just arrived in Atlanta as their headquarters. I just have to ad-lib for one moment. When we first started the summit back in 2010, we did not realize that Atlanta was the capital of health IT. We started looking to see how many companies that we had, and it was our wish that we could have 100 companies. I get on the stage to introduce and kick off the summit, I'd like to see 100 health IT companies sitting there. Well, we had the 100 plus. Today, we have over 250 health IT companies in Atlanta. We're growing, and we have grown by 5. And so at this point, we've grown by 5 recently. And at this point, I would like to introduce them and then introduce a couple of the people who are here. We have Baxter. I have to put on my glasses for this one. We have Baxter, and most of you have heard about Baxter coming in over in the Conyers area by Tata Pharmaceuticals. We have Paceban, we have Qgenda, and then we have Streamline Health. We have another one I'll tell you about in a minute. But with us from Streamline Health, I think we have some folks here. If you're here from Streamline Health, could you please stand up, please? There we go. We have Vince. Vince, raise your hand. There you go, Vince. And we have Amar. There you go, Amar. And then we have Colleen. There's Colleen. So when this is over, if you have a chance, welcome them and thank them for arriving in Atlanta. We're very glad to have you. Glad you're here. Hopefully by next year, we'll have a few more companies to add to that list, and you're all part of making that happen. So thank you all for your effort in making and continuing to make Atlanta the healthcare, health IT capital of the country. We have another sponsor who is a new company that's headquartered in Atlanta, and that is Point Clear. Point Clear is our gold sponsor for this event tonight, and we're going to ask David Carabinas, if he would. David, where are you? David? There you go. If you could come up for just a moment and tell us a little bit about Point Clear, and thank you for being the gold sponsor for this event.
Thank you, Pat. We are delighted to be associated with TAG Health, with TAG and with TAG Health in particular. Point Clear Solutions is a healthcare technology company. We design and develop technology for our clients, and that would include large HIT vendors. It would include venture capital-backed newcos into the industry that are trying to innovate healthcare, predominantly the provider side of healthcare in particular. And what really sets us apart is something that this industry needs terribly, and that is improving the user experience. We have the largest user experience team east of the Mississippi of any company that practices that craft, and it makes a huge difference for our clients. So we're delighted to have that team in place to do what we do for our clients, and we've been doing it for the better part of 8 years now. So we recently made a decision to move to Atlanta, to move the flag here from Huntsville, Alabama, because there are no healthcare customers in Huntsville. And there are a lot here. There's 250 I just heard. So no, it's a great market, a great ecosystem for us, a great place to recruit talent. We have a huge presence in Nashville and Birmingham. We have customers on the West Coast, Boston, Northern Virginia, Chicago, and this is the year of national expansion for Point Clear. And I want to take an opportunity tonight to let you guys know something very exciting that's happening with the company, and that is, well, everybody's heard of mHealth, right? So we're putting our money where our mouth is, and we're acquiring a mobile application design and development company out of New York, and we will be effective right around the 1st of November, and we are extremely excited about that. The company is called Worry-Free Labs. They're high-end, and their customers include Disney and Apple and folks of that nature. So why are we doing that? Because not only do we need that capability because our customers are demanding it more and more, it's because they have a really strong B2C capability. Consumers, they understand what consumers want in terms of mobile apps. And what's one of the 5 major buzzwords in the healthcare industry these days? Patient engagement. So we're fusing that capability with a really big emerging need in the healthcare industry in particular, and we're just very excited about that. So I want to thank Pat, I want to thank TAG Health for allowing us to be the gold sponsor, and I hope you guys have a great evening. Thanks.
David, and I want to thank you and Chris and all of the Point Clear team. They have been very, very supportive of not only TAG Health, but of our health IT community in Atlanta. One of the things that is going to be imperative for us to retain our position as the nation's capital is to have an educated and qualified workforce to fill the positions that you have in your companies. Tonight I've asked Gwinnett Tech to put some brochures or some information on your tables. One of the things that they're looking for are opportunities for their students. They have a new program in health IT, and they're looking for opportunities for their students to have internship opportunities. So if any of you have that opportunity, the information is there. and it means so much to these kids and these young people to be able to get a start in our workforce in health IT. So please pay attention to that if you would for a moment. Then I would like at this point to also just give you just a glimpse of future events. We have another company that is formed as a result of the summit. It's called the IHIT, the Institute for Healthcare Information Technology. And to the end of education, we are developing or in the process of doing a research study that will get your opinions of what you need in the workforce for training for these students that will feed back to our education institutions and to you all to make sure that we keep you with qualified workers. So if you get information from that, we would appreciate you paying attention to it. We will give you the reports. Hopefully we'll give you an update at the summit as to the progress. I'd like to introduce Mark Olson. Before I do that, Mark, let me ask, if you're a TAG Health board member, would you please stand up? Just if you're on Board of Advisors, TAG Health board member. These are some of the folks that if you want to see after the meeting to learn a little bit more about what we're doing, there they are. And Mark, with that, I'd like to introduce you. Mark is on our TAG Health Board, and he has been the chair of this event. He's pulled it all together. Mark, help me introduce you. You're doing something in Africa, and it has to do with mHealth, and it's big. Is that right? Africa's big. So Mark's going to tell you just a little bit about that. But while he's in the United States, he's working at WellStar, and you are the Director of Operations for WellStar.
For primary care.
For primary care. Thank you for helping me. So with that, I'll let Mark take over and introduce the rest of the program.
Good evening. So again, my name is Mark Olson, and my day job is Director of Operations at WellStar, where I help to oversee primary care and behavioral health. My passion is mHealth. I also have founded and lead mHealth charity in Africa. Right now, we are equipping hospital systems there with cell phones, and we soon hope to expect by the end of the year to be the largest mHealth site of its kind in the world, and we'll be covering 200,000 lives in Africa, or specifically in Kenya. So anyhow, right now, as we know, healthcare has seen a dramatic transformation, and mobile technologies are a chief enabler of that. It's rumored by 2016 that there'll be a projected 10 billion mobile phones in the world. Smartphones have also seen penetration have hit a critical mass with over half of the US population owning a smartphone. And this is across almost all demographics. The event tonight is really going to be exploring this and seeing how doctors are redefining how they practice medicine, how patients are engaged, and what business models make it possible. So much can be spoken about the mHealth conversation. It's very broad. For tonight's purposes, we're really going to focus on a few different areas. This will not be a policy, security, or privacy conversation. Really what we hope to focus on is patient outcomes, consumer engagement, patient engagement, and also the business models that make it work.